Hi, everybody. This is Dr. Joel Beck, and I'm the owner of Beck Aesthetic Surgery, Surface Med Spa and Wellness, and also Waverly Surgery Center. And I really wanted to address some of the different trends that we're seeing in the community and how we may differentiate ourselves from the community and also in general. So I would like to introduce first Heather Rypien, and Heather has been working at Beck Aesthetic Surgery for about a year and a half already?
No, I think we're coming up on 2 years, Dr. Beck.
Wow, crazy.
Yeah,
Can you do a little, just kind of review your background so everybody
sure.
could hear
Yeah.
about how,
Yeah. I'm Heather Rypien. I have been a nurse for 24 years. I've been in this aesthetic space for about the past 15. Started out in lasers, but found my calling in injectables. And I have recently joined Dr. Beck. My hometown is Charlotte, but when I started, aesthetics was just starting. There just wasn't much around. So I kind of wanted to dive in and seek out the best training in the country, which led me to some opportunities that I couldn't find in Charlotte at the time. So I found myself working in New York City, and I have been practicing in Manhattan on the Upper East Side for about 10 years now. Going back and forth every week, but really wanted to spend some more time at home. So I still see my patients in New York City, but I only go up once a month now instead of every week. And found Dr. Beck, and after looking at several options in the area, just found like we were like-minded in what our vision was and what our core values were, our ethics, and just thought it would be a great place to partner with. So I see patients in both places, New York once a month, and Dr. Beck on a limited basis right now because insanely at 53 years old, I decided to go back to get my nurse practitioner degree. So I've kind of been putting my focus and energy into that. My passion is injecting, but it's also in educating and mentoring the next generation of injectors. So I have been a national speaker and trainer with Allergan and Galderma, now just Galderma, which I've been with for 7 years. And I actually have been the top utilized trainer in the country for this is my fourth year. So I feel like I found my calling getting to do a little bit of everything that I love. So yeah, that's kind of in a nutshell my crazy life.
that's great. That's awesome. Thank you for reviewing that. And Abby Gaskell is our newest injector, and she is definitely not new to the market. And Abby, can you kind of give a little review of yourself?
Yeah, so my name is Abby Gaskell. I'm a board certified physician assistant. I have a doctorate of medical science. I've been a PA now for, oh my goodness, 14 years. How time flies. Most of my background has been working in surgery, mainly ortho trauma. I've done a little bit of emergency medicine. I jumped into aesthetics about 6 years ago, and along with aesthetics, have just fallen in love with looking at treating the whole person and just have included wellness and hormone replacement therapy into our practice as well. I, like Heather, also split my time. I'm a trainer for a company called PDO Max and for Prolinium. Education is also a passion of mine. But I split my time between Charlotte and currently Fayetteville, and I see patients 3 days a week, 2 to 3 days a week in Charlotte, and I just love educating other patients about the science of aging, and just love to educate our patients about how this is medicine and not just picking up a needle, but this actually is medicine. So.
Yeah, yeah, thank you. So, one of the trends that we're seeing is, I guess, a fear of fillers. And I wanted to get both of your thoughts as far as why you think that's so, and maybe touch base on that.
Okay. Do you want me to go first?
Go for it, Heather.
Okay, so it's funny to me. I think that we've done this to ourselves. Providers have absolutely done this. The science has been there, and we have evolved. Back when I started, we had 4 hyaluronic acid dermal fillers. We had Kaha, Radius, which is a calcium-based product, and Bioregenerative Sculptra, which is a biostimulator. And I think that we all of a sudden got inundated with all of these different options, and we saw such an excitement, especially post COVID, of people that we went from the phase of everyone being afraid to do anything and doing like probably under treating patients to polar opposite, gangbusters, just filling them up with hyaluronic acid. And so it's trends, but I always say like trends aren't the best thing. You want something that's sustainable that we can maintain. And I think it's come full circle back to right now we're entering the undetectable era. And I'm so excited because we have all of these new cutting edge things that, I know we carry in our office, and we'll probably talk about it later, but sculpture is probably my number one procedure. And PDGF is like where it's at, like PDRN, all of these things that they can't really make you look unnatural. I think there's always going to be a place for filler because with these biostimulatory products, you can't get targeted projection. You can't get enhancement of a feature. So I think now full circle, learning how to incorporate less is more and starting to address the underlying cause, not the symptom, is full circle, like bringing us back to natural. But that's why I stayed with you, Dr. Beck, and I was very, set on staying with a plastic surgeon. Not that there's anything wrong with med spas, but a lot of people just starting out, that's where they get their foot in the door. And I think patient education is so key because I always say it's not the product's fault. There's a perfect recipe. It's the wrong amount of the wrong filler done by the wrong provider.
Right, right. It is interesting because I think a lot of people are concerned about looking overfilled or being just a fear of looking not the way they want to look. And what do you think about that, Abby?
I agree with you. I think one of the big things too that we didn't have access to a while ago is just social media and just perceptions of how now there's filters on a lot of things like Instagram, TikTok. A big thing too is how photos are taken, like shadows and lightings, but that fear of looking overdone is one of the big concerns. Also, I think there's a lot of times a filler regret where we didn't know, kind of what Heather touched on about how we've learned so many things, especially in the last like 5 years. And Heather's been in this industry for a long time. And just as she mentioned before, how our knowledge of facial anatomy is changing and how we follow different, properties like line of ligaments and things like that. And that's definitely contributed to what we've known over time. Also, things like having access to be able to use an ultrasound to like pre-scan patients before, because everybody's anatomy isn't the same, especially when, participating in cadaver labs. Things don't look how they look on a textbook. And what we're finding is that when filler was placed, we didn't know something, and now we're finding that a product may last longer than what we originally thought it did, or people's anatomy is different. And so we're having to go back, and now we're in kind of like Heather touched on, this dissolving era where we want more of that natural look versus otherwise. So I think the important thing too is like anytime it's just comes down to facial assessment. It's not a paint by numbers. Everybody's anatomy is different. Everybody's pathophysiology is different. We're treating, the actual problem and not the symptoms. And those are different things that we can do to prevent kind of like this overdone or this fear of people wanting to get fillers. So I think that's really important.
Another thing, Dr. Beck, that, I have to, hats off to you about this is, I've been with you for 2 years now and, started to, grow the aesthetic side of, Beck Aesthetic a little bit more. Is another thing that I think might come into play, and I know you're probably going to touch on this later, is like private equity and business sense. I have, the pleasure of saying, like, I'm not a business owner. Everyone's like, oh, are you going to own your own practice? I'm like, I have no desire. I want to see my patients do the best that I can do. And so thankfully, I'm not driven by business decisions, but I think that, I learned a lot. I went to the Galderma factory in Sweden, and I've got the pleasure of sitting on multiple advisory boards and really understand the importance of the rheology and gel science. You let us use what we think is best for the patient, which is safe for the patient. You're not swayed, and nor would you ever, that I've never known you to have said, you know what, I really need you product because it's more cost effective. And I think that sometimes some of these businesses are starting out, money is an issue. And I think that a lot of them, they shouldn't, but I do see it out there, will use products based on cost, not what's best for the patient. And in my opinion, I know that rheology, especially the Galderma portfolio, in, out, backwards, upside down, you pick something, all of these gels do something specific. Some of them are more structure, some of them, more support. Some of them give a little bit of fluff. You have to understand, do they pull water? Are they going to migrate? You can't, in my opinion, pick up one specific filler and do a lot of everything all over the face with it. And so I think, you say, why are we seeing these problems? But I think that is a contributing factor as well.
Well, I also think that, like I'm a plastic surgeon. I used to do injections a lot, but, quite honestly, my interest is in surgery and technique and outcomes with surgery. And to have the two of you who've been so well trained going to different training sessions uh, is a real gift to the practice and a real gift to the community. And I don't think that is the case for probably over 90% of the other facilities or places. I mean, I'm seeing now like friends practices being bought by big equity or private equity or these med spas that are just growing, growing, growing. And I know that, at least Heather, you've had the experience working in these big corporations. And what's it like versus working in a small office where you're going to make the decisions on how you're going to take care of the patient rather than somebody dictating things to you? Or
Well,
yeah, go ahead.
I have a very strong personality, as everybody knows, and you're not going to change the way I do things. You're not going to change the way I think. I did leave. So I started out with a very well-known facial plastic surgeon in Manhattan. And for a small second, did a place that is a large with multiple locations. It was not a good fit for my personality. I have several friends that are trainers that have practices that have been around forever. And I just find that, people come in, and when you're that big, I understand that when you have that many employees, that everybody needs to be consistent. But I'm not the first to jump on new innovation, but when you're in those big places, it takes a long time to bring on something else. And when they finally bring on something new, there's something better out there, and I think you're so limited to what you can do as an individual provider. You have Abby and I that, you trust us. We're not cowboys. We're not going to come to you with something like, Dr. Beck, everybody's doing this. Let's do it. We come to you with the science. I think this is beneficial in our practice, and you listen to us. And that's something these big corporations don't have. And I have a lot of friends that have been in this space that are my mentors that are like 25, 30 years in. And the ones that really care about their practices, they're like stuck because a lot of these private equities are saying, okay, we'll acquire your company and you're going to stay on for the next 5 years in transition. But then for them to come in and see the dollar and try and change everything that made your business successful, it takes the decision-making capabilities out of the clinician, and it's now about the businessman. And I just don't, maybe I'm wrong, but I don't see how that's beneficial. You can't take away my decision-making capabilities and you're come to me and ask me why, because you don't understand the science. So that wasn't a good fit for me. I'll stay in private practice. I feel bad because I have some friends that own med spas that are amazing, but more than not, the majority are not places that I could see myself working at for multiple reasons.
And kind of going off what Heather said, I worked at a med spa that when I first started there, we were in the process of the purchase had just been made to private equity. And it took, the first 6 months were great, but after that, we started to see changes where it was about the number. Everything's about the dollar. It's about, making their biggest profit margin. And like Heather touched on, it's not what's best for the patient. And as medical providers, we made an oath to our patients of do no harm. And so for me, like being told to use a certain product or remain in a certain tier so we could get our product at a better price point when I know it's not the best for the patient or just the best in general, or what the data says or what the science says, that it may be harder to dissolve or there's more complications. I think that it comes down to ethics and how you ethically feel. And also too, just because private equity comes in, it doesn't mean necessarily that they are up to the same standards that a private practice is. Do they have their standard operating procedures? Is there a physician who's actually trained in-house who is of plastic or dermatology or has background or has been to aesthetic training? A lot of these physicians have done a quick weekend course and just they have multiple med spas where it's just their job to kind of oversee these areas. And we're losing almost this safety concern over this because it's so quickly replicating versus looking at, okay, like, we ourselves as an industry are shooting ourselves in the foot and creating these fears and these, I don't want to say myths, but essentially we need to almost have some form of certification or regulation and checks and balance points to maintain that the fact that our patients are receiving the best possible care to make sure that we're doing no harm.
Yeah, yeah. So as far as complications from fillers, there's a number of different things, but how do you guys approach the complications? I know that there's a kit that we have. Can you make some comments on that, just so that way patients, if there's ever an issue that come to our office, that they know that we're ready, that we would anticipate something, and that they should feel comfortable.
Yeah. So first of all, I always tell people in the new providers that I train is wrap yourself in as much insurance bubble wrap as possible. What does that mean? Every patient, and if any of my patients are listening to this, no, I sit down, and even though they're signing a consent, it's informed consent. And I'll say, I'm going to tell you some stuff, and it's probably going to scare you, and it should, because this is medicine and there's a risk of a problem. But in the event, this is the worst thing that I can conceivably think of could go wrong. This is what we have in place to manage it. I brought in that emergency kit that my friend Yvonne came up with. And what it has is it has a symbol. I made a thing on my Instagram on it. It has a package that manages almost every complication that you could conceive, visual disturbances, occlusions, bruises, everything that's in there. We have an ultrasound in our office, and we have each other. I mean, Abby's new to our practice now, but I have her that I can go to, and I have you, and I have a thick string of providers with far more knowledge and more experience on my 911 on my phone. I don't do anything that I cannot get myself out of, and I will not inject anything that, I haven't done thorough research on. Like PDGF, we're just learning more and more about it. It does have off-label indication for like joints and wound healing, and we don't have an aesthetic, complications or FDA approval yet. There are studies going on right now, but I waited a long time and went to many of my colleagues that, have been incorporating in their office. I'm never the first to jump on the latest and greatest, but I just tell my patients, this is medicine, the practice of medicine, and we don't know what we don't know, but you have backup 24/7. You can reach out to any of us. And I think that's the one thing, we all put safety first. And if there's any question, if a patient comes in and they have a cold, probably not getting injected by me. I think a lot of complications, providers don't take the time to get a thorough, comprehensive medical background on patients. Have you recently been to the dentist? Have you had any vaccinations? You need a robust immune system for anything foreign going into your body, period. And I'm, and that's the thing about big companies too. I don't want a number. This is your goal hanging out somewhere in my face that I feel like I have to meet that goal. If today is not your day, if you're not comfortable, if you need to think about it, if you're not feeling well, that's okay. There'll be another day, and that's a thing. Safety first. You need to be healthy. So, going back to MP school, I am learning more about comprehensive physicals. And now I have Abby and I have you. If there's a medication someone's taking that I'm unsure of, like, I'll go ask. But no one gets injected by me that's not healthy to start with in the first place. And I think that's the first line of defense in, keeping the patient safe.
Yeah, I think that would go the same with Abby and then myself as well. And quite honestly, while the complications are rare for fillers, they do exist. I've had to deal with a complication, and I probably am one of the top people in the country now to ask about that complication, an allergic reaction towards filler, which is extremely rare. Unfortunately, it had to happen to my wife when I did that years ago, and we've gotten through that. But yeah, they are real, and it's something that we take very seriously, each and every one of us. So that's another reason to come to an office like this rather than somewhere where they just, want somebody to do their injections for them. I want to talk a little bit about the regenerative side of things. That's kind of a little bit, newer on the market. We have, as Heather mentioned, platelet-derived growth factor. It's called Ariescence is the name, the product name, and it is FDA approved. It is used off-label, and we can use that for aesthetics as well. And then there's other things like platelet-derived, PRP, platelet-rich plasma, where we can actually draw your blood, and it's called PRP, or platelet-rich fibrin gel. And so we draw your blood and we centrifuge the blood using different tubes, and we can actually collect the albumin side of the blood, which is the protein part in your blood, and we can make a gel out of that. And then we take the growth factor portion, the platelet-rich fibrin portion, and we can isolate both of those. And we could just inject the platelet-rich fibrin for different purposes, or we can take that and mix it with the albumin portion, make a gel, and use that to use it like a filler, but there's no filler in it. It's only your own blood product. There's no additives at all. And so that's been something that we've been able to use. While it's kind of the off-label version, it's still something that, as long as we educate the patients and have them know what we're doing and the risks associated with it, it is something that it could be very beneficial for people, especially injecting maybe around the tear troughs or in the cheeks, and for somebody who does not want to have any foreign material from a product that we get from Galderma or Allergan or one of the other big companies. So I think that's something there's been a lot of interest in that and a lot of success with that.
I do
and
want to clarify one, if I may, Dr. Beck. I want to make sure providers listen to this, and and patients. I just clarify. We do carry the brand Aerie Essence in our office, so there is no FDA approval for cosmetic indication of PDGF. However, Aerie Essence is not labeled to be injected. So for any patients that may have heard conflicting, information, Aerie Essence comes with two different products, the actual PDGF in it and hyaluronic acid. When you combine them, that is Aerie Essence. In our office, we are not injecting Aerie Essence. Aerie Essence is applied topically after microneedling. The only thing that we inject, just to cover us, is PDGF. We are not injecting Aerie Essence. So if you're hearing Aerie Essence, there's some confusion. PDGF is a component that, when mixed, is created for the Aerie Essence brand. So it can be applied topically after microneedling, or PDGF itself, not Aerie Essence, is actually injected. And where we're seeing phenomenal results, and that's why we're going to put a little picture with my name here, and Heather's video is not up today, is I had my second treatment of PDGF for my under eyes yesterday, and I actually had Sculptra done in my neck, my chest, and many of you may not know, but when you are in your 50s and you take care of your face, you start to realize your body's sagging. So for someone that doesn't need a skin tightening surgical procedure, you can get beautiful skin tightening and thickening of your dermis with Sculptra to areas like I did, which were my knees and elbows yesterday. So PDGF for the hair, for the under eyes, is thickening the tissue. It's not building volume, but it's thickening your skin for crepey under eyes and brightening up the eyes, hair. And then, of course, for take home, we have plated. So we have topical exosomes, which is amazing. And I'm excited. I am going to the Mayo Clinic in October to sit in an advisory board. And I'm excited to sit down and hear all of the science behind that, because we're having a lot of success with that product in our practice as well. So we have like the procedures from Marissa, and your topical, to the injectables, to the hormones, and then a take-home exosome that you can take for skincare. So we're trying to cover all the bases to keep you as natural as possible, taking care of multiple things, not just filling lines.
Is there anything that else you guys think that's trending that you would like to mention with regards to the injectable side of the business?
I think definitely wellness is becoming more of a trending component, and hormones. I think right now, when people come in and they talk to their provider, they're getting frustrated. The average physician spending about 7 to 10 minutes in the room actually with patients, and they don't feel heard. And so what I'm finding is just running our wellness component side of the practice. What I love about being a part of this practice is that we look at the whole picture. We're not just here for surgery. We're not just here for aesthetic procedures. We're here looking and treating from the inside out, utilizing things like peptides, GLPs, and hormones. But we do a full workup, and we look at everything. So even though you may be coming in wanting like a hormone replacement or to discuss that based upon symptoms, we're also looking at things like your thyroid, we're looking at your vitamin D, we're looking at your vitamin B, we're looking at your iron, all of those things, because everything's connected together. And then two, doing things like intake as far as, how does your nutrition look? Because if you're on a GLP and you're not putting in the work as far as eating healthy, well, that causes inflammation in the body. And I think a big component of this is just calming down the inflammation. And that's a big thing right now that's trending. Our patients are becoming more advocates of their own health, and they're learning more through social media, but also through online. And they're doing this research and coming to you and saying, hey, like this is what I found online. Like, can I do this? And there's just so many other options. And I think that's just definitely important. Just the whole picture. I mean, we're a very unique practice, and the fact that we have amazing providers. We have Dr. Beck, Dr. Sepp, who's a urogynecologist, excuse me, and we're all in one place. And the fact that we can work together as a team, when you check in, I mean, when you meet Joy and when you meet Lisa, they're going to be there in your pre-op appointment. They're going to be there during your surgery. They're going to be there in your post plan. And the fact that we work together to say, hey, now that we've done your surgery, let's look at this. Let's look down, like, how are you feeling? Are you exhausted all the time? Do you have energy? Normalize talking about sex and sexual wellness. And I think that's just one very unique thing about our practice compared to these other practices that are being bought out by private equity. It's a quick, like, oh, yep, one and done, or a place where you can call up and get your testosterone injection shipped to your house or your GLP shipped to your house and are under no care of a provider. And I think that's one thing that makes us unique is we really care. We are a team. We work together. We care about the whole picture. And especially moving into the regenerative phase. I mean, Dr. Beck, you were doing things with stem cells that other places aren't doing, and we're just very much cutting edge as far as doing what's best for the patient, what's safest for the patient, following the literature, and just treating the patient as a whole versus just one thing.
Yeah, I think that my interest in a holistic approach has always been there from the very beginning of time in my medical career. And I think now that we have a clinic and a surgery center, and the wellness aspect, that allows us to be able to do a lot of things to treat the whole person, like you said, and nutrition and exercise and putting it all together. And how can we make a patient heal faster from surgery? How can we get them to do better before, or take care of themselves before surgery to set them up for an anti-inflammatory type of diet so they do better post-operatively? Do we combine that with, like, I don't know, hyperbaric oxygen? I mean, those are all the things that we're really entertaining and that we really want to bring to the community. And having a team, the two players and our team in general is allowing us to do things that really are going to be very creative, safe, and effective for our patients. So.
Yeah, and I think that another thing that I like, and I think it's a misconception, you're seeing all of these phenomenal facelifts, and people are like, oh, this surgeon. The big difference to me is surgeons are incorporating multiple surgeries in one visit. It used to be, I'm getting a facelift. Now, when you're getting a facelift, if you want the overhaul, just like fillers, we don't just do one area. You have to address everything to stay natural. They're getting upper and lower bleps. They're getting brow lifts. They're getting all that. But one thing patients need to know, surgery is not the end all be all. It does not mean you will never have to get another procedure. It doesn't mean you're not going to need a biostimulatory product. It doesn't mean you're not going to need, filler. You have to maintain your surgical results. And I love that we can work together to say, what you're needing is really, because the patients need to perceive value. They're entrusting us with their valuable dollars and their time and their health. So for us to be able to say, I just don't think you're going to find perceived value. What I can offer, it's time, surgery is really going to be your best bet, but I'm here for you after surgery. Whether it be a year, whether it be 2 years, we can treat that patient over the spectrum of, the next coming decades right in our practice, and we can work together to see what best, intervention and how to maintain that facelift. Even fat transfer, if some of that fat, settles and you need more, you don't need to go back into surgery, but you can go talk to Dr. Beck, see if he can harvest more fat, maybe add a little bit more. If not, well, maybe let's look at PDGF. Is it skin quality? So it's nice to have a comprehensive consult in our office, and you are so good about me being like random grabbing you in the hall. And patients are like, wow, the surgeon's going to come in and see me. I didn't have an appointment. And I'm like, well, he's right here and we're probably going to put him behind and get yelled at by Lisa and Joy, but let's just grab him. And, you're really good about coming in and saying, this is what I think. And if it's something that's a detailed conversation, you need to come back for a consult, but you are always willing to step in to give your point of view and bounce stuff off. And you've grabbed me, if it's an injectable thing, Heather, what do you think? And I love that. And I think that is so unique.
I think it's very unique, especially like having the physician in the same clinic that we have all the, aesthetic, injectables as well. So yeah, I'm always here.